Welcome to Hematology and Hemostasis. My name is Carleen Van Sicklin, and I'm going to be your course instructor. I just wanted to give you a short background about myself. I graduated from Norwich University with a bachelor's degree in medical technology. I completed a master's degree in health service administration. I have 25 years of clinical laboratory experience and have been a NACLS Medical Laboratory Science Program Director for 10 years, where I taught across the curriculum. I've taught chemistry, hematology, immunohematology, immunology, microbiology, urinalysis and body fluids, and clinical correlations. In addition, in the city of Jacksonville, I've worked at Shands, Baptist Medical Center, and Mayo Clinic. I want to just give you a brief overview of our course. I'd like you to read the syllabus and review the schedule, and then go into the discussion board and sign the affidavit that you understand that. If you have any questions, feel free to ask questions at this time. Next, we want to look at course content. You can see that the course is actually divided into 5 modules. Unit 1 is an introduction. Unit 2 is red blood cells. Unit 3 is white blood cells. Unit 4 are platelets. And then Unit 5 is hemostasis and coagulation. Let's just take a look inside one of the units. The units are broken into weeks, and for the different units there are case studies. And I want to go over how we present case studies in this course. For the case studies, each student will be assigned a case study. Okay, so here you can see on Monday, the first student in the group of 4 posts the case studies, and the case study has to include a peripheral blood smear for the other students to review. After the person posts the case study on Monday, on Tuesday, the next student in the work group posts study questions, asking open-ended questions to assist other students in their group to identify and analyze the information in the patient's history. On Wednesday, the student is going to post the answers to those questions using information that we have covered during the lecture. On Thursday, the student is going to propose a diagnosis based on the patient's history and clinical laboratory findings. And then on Friday, the person that submitted the original case study is going to share with their group whether they came to the right diagnosis or not, and as well as state the references that they used to create the case study. And then I will provide valuable input for the group as they prepare for their examination. We also want to look at how each unit is set up. So if we just go to Unit 1, we can see that Unit 1 is divided into weeks, and then within the week there may be more than one chapter that we cover. So if we look at the Chapter 1 objectives for this week, we can see that there are 5 objectives. In addition to the 5 objectives, there is a PowerPoint presentation. Most of them will be narrated as well. And then there is a short quiz. The quiz is directly related to each of the objectives, so if you complete the objectives, you should do well. For example, here's the first question, and this question is directly from Objective 4. At this point, you may be asking yourself, what should I do first? Review the course syllabus and go to the discussion board and post that you have read and understand the syllabus. Ask any questions that you may have. Then your next assignment is to say, who are you? And that's another discussion board assignment where you'll introduce yourself to your classmates. Include if you're a part-time student or full-time student, if you're currently employed, how you became interested in medical laboratory sciences, perhaps your short-term goals or your long-term goals. I look forward to spending the semester with you, and hematology truly is a blast.